Hi, everyone. This is a course that I'm giving, and it's called the ALF Approach. Super excited about presenting this course to you. It's a 2-day course packed with a lot of information, and it's an overview of the ALF Approach. Let me just briefly go through some of the topics that we're going to cover to give you a sense of, what this course is about. I think a picture says 1,000 words, and we can see here that this picture depicts the difference of a child who's growing with airway deficiency, with a malocclusion, which creates bad posture. The posture can also create the malocclusion. It's always a chicken egg. And with the early intervention with the ALF appliance, we can see how a child can grow into more of an upright, head forward, mandible coming forward, larger airway experience. So this is part of the part about what the ALF approach is all about. So let's go on. In this course, I go through briefly about osteopathy and what is osteopathy. This is Dr. A.T. Stills, and he's the founder of osteopathy. And the basic principle of osteopathy are the basic principles of the ALF approach. If we understand the principles of osteopathy, then the dentist and the myofunctional therapist and the osteopath working with the ALF dental appliances can understand how to adjust the appliance and to differentiate how well the process is going by being fulcrum based within the osteopathic principles. So if you understand osteopathic principles in practice, you'll understand the principles of the ALF. And this is an example of one of the principles of osteopathy, is that structure creates function, and function actually creates structure, that they're reciprocal, interrelated. And so how the tongue rests in the roof of the mouth and develops the roof of the mouth, which also helps bring the face forward, is the function creating the structure. Now, if the structure collapses and doesn't have the tongue up, the structure can't hold the function, and then we need to do something about changing the structure. So they're reciprocally interrelated, and this is a basic principle of osteopathy. And so the ALF appliance was created within the womb of osteopathy, and we need to always go back to basic principles when we're working with the appliance to really understand how it works. I'm also going to talk about Dr. Sutherland. And Dr. Sutherland is the founder and the founder and discoverer of the cranial motion. And there's 26 bones in the head. They all move, and they move for a certain reason. They have a certain function. So motion has a certain function to it. And Dr. Still says, allow the physiological function within to manifest its own unearning potential rather than apply a blind force from without. And this applies to how we're working with the cranium and the malocclusions and the posture. Instead of applying a blind force from without, which is like using traditional braces, let's say, let's see what the body can do on its own by augmenting its normal growth patterns. So when we use an appliance like an ALF, what we're doing is augmenting normal growth and development. So we get less compensations throughout the body, which is helpful. So this is an amplified MRI looking at brain motion. And let's see if you can see that. Here on the left, this is unamplified, but we can still see the movements happening through the brain. And here, this is amplified. We see the whole undulation of the entire, let's play that again, the entire central nervous system and the spinal cord. And this is the motion that's happening inside of our head. There's motion throughout our whole body. And every organ has emotion to it. And the cranial bones have emotion also that's very, very specifically defined by how the sutras come together. So that's something else that we go through this course. There's something for every single profession, for all three of the professions that are working within the ALF approach, for the osteopaths, for the osteopathic physicians, for the myofunctional therapists, and for the dentists. So this is part of what the dentists and myofunctional therapists need to understand, is how the cranium moves, because how it moves and how the teeth come together and how the cranium sits on top of the neck are all interrelated with one another. We can't just move teeth without looking and knowing the whole of the complex of the body and how it shifts everything. It's all interrelated. So this course is about the details of that. This is a neonatal skull that's blown up to the same proportion of an adult skull. And what we do in this 2-day course is we go through what are the functions that create a face. We look at how swallow and breathing and chewing actually develop into an adult facial features. And we also talk about the things that can go wrong, the things that can inhibit the functions of a baby that can create malocclusions when we're older. So if we know these, we can look and we can intervene early with our babies and our infants to make sure that the nursing is going well, that the eating is going well, how they're breathing. So breathing is keystone of facial growth and development. Very, very important to be able to assess it. And what about the face? Well, it grows anterior and inferiorly. It grows forward and downward. It's actually not exactly that. It's actually the growth centers are back here. And as these increase in osteogenic potential, you have the face that drifts forward. But it's the same basic concept. It comes forward, and as it comes forward, it opens up this back airway. So we talk about all the functions that create a forward-moving face. We also talk about the appliances we want. This is a key point for the osteopaths. The osteopaths, we are all working so much up on the vault, and look at the vault. We've got to learn all the intraoral functions that are affecting the base of the cranium. So for osteopaths, this could be an upside down cranial course in terms of looking inside the mouth. My job is to get the dentist off of inside the mouth and to look at the whole body posture, and to get the osteopath off the head and to look in the mouth and look at what's happening inside of here that's creating an effect up top. And the myofunctional therapists also need to understand the function of the cranium and the cervicals and how it sits on top of the head, and how that affects how the teeth come together, and then how that affects with the tongue function. There's a lot that's missing, especially around TMD. So I have a whole lecture on TMD and how that affects dental occlusions and the importance of myofunctional therapists to learn, and osteopaths especially to learn. So this is the ALF appliance. It's a light wire that goes behind the teeth and it augments normal growth and development. But what it also does, which is amazing, is that it actually stimulates the cranial motion. And that's how it creates a holistic, integrated orthodontic approach. I talk about birth and birth history and the importance for dentists specifically to be asking the questions about birth history and about nursing history, about latching history, about how the first functions of the tongue and breathing, how did they integrate, and how that then affects facial growth and development. Osteopaths need to know this too, as well as myofunctional therapists. I talk about the newborn's occiput here, actually in four different parts when they're first born. And we have membrane between each of the bones, and we have nerves coming out. So if there's a torque or a twist within the fascia or compression that happens, that affects the neural integration of those nerves, right? And we talk about the very specific nerves, 9 through 12, and we talk about what they do and what happens when they're not functioning well. Basically, what happens is you get a colicky baby. So babies that are colicky or have torticollis, they can't move their necks well, which looks like not being able to nurse on both sides. These are all early signs of facial growth and development issues and malocclusions. So it's looking at kind of the underlying etiologies of malocclusions, which are really based in the somatic dysfunction initially, because when babies are born, there are no teeth. The teeth come in the position they come in as a result of the different facial strain patterns, the cranial strain patterns, the motion of the tongue, the function of the tongue, the resting position of the tongue, the cranium and how it sits on the neck. So we go through all of this in this 2 days. Mouth breathing, we talk about the importance of breathing and having tongue up on the roof of the mouth. And when that doesn't happen, we get malocclusions, we get crossbites. So the structure is really an expression of the function. That's what we're really talking about. So let's look at our functions, what we can do. We talk about facial growth and development, what happens when you don't have a good lip seal. We get a long face here because the face is trying to open up in the front to compensate for the back being narrow. We're trying to optimize oral volume in whatever way we can. We talk about a bigger picture of breathing rather than just airway. So most of the dentists are focused on the CBCT scans and looking at the picture of what it looks like in the back, in the posterior oropharyngeal space. But breathing is something that happens to the whole body. So we talk about the importance of looking at what are the breathing structures or what's the function of breathing and looking at the larger picture so that we can treat the person as more holistic, not just treating a structure of a space, but treating function. This is a little one, and this is the change that happened with an ALF appliance. She's in a Class 3 crossbite, look at her eyes, upward gazing, head down, upward gazing, maxilla coming behind mandible. And in 6 months, actually, let's look at this. This is what happened. This is what she looked like before. And this is when in 2012, obviously the dental occlusion changed. But this is what she looked like in 6 months. So in 6 months' time, a class 3 occlusion changed with the alpha clients. And that was simply because we're able to widen the upper and allow the tongue to come up. And as the tongue comes up, it changes the position of the head on the neck. And now the eyes are able to have more horizontal gaze. Extension patterns, we talk about cranial strain patterns. Some of us have extension patterns where the cranium is narrow and high, and some are wide. And we talk about the expression of that in terms of our malocclusions. And this is this little one, how she did after, and we can see that she's doing well. This is a picture that a lot of us already know, but there's a change that's happening in human beings, in our development that's happening, and we're getting more of a head forward posture. Why is that? It's a complexity of multiple factors that are creating how we're looking today. Basically, our physical expression is an expression of our environment. What we put into our body and what we breathe, our body posture, and how our teeth come together. But we are all starting to be a bit more like a bulldog, where we're pulled back. Both maxilla and mandible are being pulled back, and it's affecting what we call our airway. This is a sagittal section of the CBCT scan showing the narrowness of the airway. But again, in this course, I talk about a bigger picture of breathing. I also talk about different appliances. I can compare the rapid palatal expander with an ALF and looking at the difference. So this is a finished case of a rapid palate expander and the beginning of an ALF. And this is the end of an ALF, I'm sorry. So this is the end of a rapid palate expander, and this is what the airway looks like at the end of an ALF approach treatment. So the ALF, I talk a lot about the ALF and how it works. And it expands 3-dimensionally, not just 2-dimensionally, like a rapid palate expander. And it brings the rest of the body with it. It unwinds cranial strain pattern. It encourages the tongue to be in the palate position. So this is a great example of how occlusions can create somatic dysfunction. This is a boy who has a crossbite on his left side, and he had a scoliosis that developed. And I'm trying to show the parent that how their teeth come together is affecting the scoliosis. And so what I do is, as you can see, there's a tongue depressor. I'm going to put it straight across and have him bend forward with the tongue depressor in his mouth. And in doing that, we clear the crossbite. So we take out the crossbite by creating a horizontal plane, and we see what effect it has on the body. See from the side. Mm-hmm. Okay. So there's his twist. And let's put this in and bite. So now we're clearing the crossbite. Open it again and bite. Like that. Okay. And see, he bends forward, and that rotation is mostly gone.
I would say.
So we talk about the posture of the body, the somatic dysfunction of the body, how that affects malocclusion, how malocclusion affects the somatics of the body. I also go through and talk about the lymphatic system, the very important lymphatic system that we found is also within the brain, called the lymphatics. I talk about cranial motion, the importance of cranial motion, and the brain drain, and the importance of how the cranium comes together and where most of the lymphatics in the brain drain. And I correlate that into also tongue function. So bringing together all three professions. I talk about the face here and the inherent motion of the face. I go through each of the bones of the face and talk about their specific motion. I differentiate different dental appliances and their different vector forces that they create. And then lastly, on Sunday, usually the second day, I talk about TMD, and I go through all the muscles that are associated with TMD. I talk specifically about the very, very unique joint that the TMJ has, and what are the components that affect the growth and development of the jaw. I talk about the importance of how the muscles that attach onto the sphenoid, which is a pterygoid plate here, so osteopaths, I talk about the very importance of learning how to treat these muscles. This is the lateral pterygoid and the medial pterygoid, and the importance of bringing together the muscles of the jaw, the inherent motion, the cranial motion of the face, the cranial motion of the cranial bones in relationship to how the teeth come together. I talk about tongue function. This is the genioglossus muscle, and about when this is tight in ankylosglossus and tongue-tied and tethered oral tissue, how that affects the temporal bone because it attaches to the temporal bone. I go through all the muscles that attach onto the temporal bones in terms of not just the cranial motion that's happening there, but the postural changes that happen when you have TMD and how that affects the temporal bone itself. I go through the muscles that attach on the styloid process, which is also the temporal bone, and the importance of that. I talk about the very important muscle, the lateral pterygoid, and attaching onto the disc, and the importance of treating that. Talk about the difference of functional chewing and dysfunctional chewing. Dysfunctional chewing would be these two pictures here, and how that affects the growth and development of the mandible. And I talk about complementary ways of treating jaw joints. For example, I do a lot of PRP in the jaw joint, which helps with growth and development of the joint and recapturing the disc without having to do surgery. I talk about the hyoid bone. This is one of my favorite lectures to give. I think of the hyoid as a mini mandible because you can see it's structured very clearly, very similarly. And the 12 muscles that connect onto the hyoid. We don't hear a lot about the little hyoid bone, and it's a bone that's suspended in soft tissue and has a large effect on tongue function, tongue stability, jaw joint, and the base of the cranium and the temporal bone. So we need to learn about it. We learned about the functioning and the motion of the hyoid, which was right here. Watch that again. What are the muscles that affect the motion of the hyoid? What happens when the hyoid bone doesn't function well? We learn about the muscles of swallowing, attaching to the hyoid bone, attaching up to the base of the cranium, how cranial motion is affected by swallow. Very important to know. And in the end, we tie everything together by talking about we're one unit. We can't differentiate. We cannot take the dental occlusion apart without affecting the whole body. We cannot put in a lift in the foot without affecting the pelvis and perhaps even the TMD. So it's all one unit. So I bring it all together of trying to understand that we are multi-complex human beings and we're mostly fluid and we have the capacity to shift and change based on input in our body.